Hey guys, Amanda here. So I was going to make this video before today, but stuff happened and I got very stressed out and I'm making it today. So here we are. So welcome back to my channel. I'm Amanda. And if you're new, welcome to my channel. So I'm going to be talking about my pre-op appointment, but before I get into that, I just wanted to kind of go over why it took me a little bit to make this video. So my pre-op appointment was on Friday. So on Wednesday, last Wednesday, so December 1st, my son was scheduled to get his braces. And that did not happen. Why that didn't happen is because on our way to get onto the turnpike to go to get his braces, my car overheated. And luckily where we were, there was a business and you could pull over because we were right in the lane. So the traffic would have had to go around us and everything. So we were able to pull over. And we had to get my car towed back to my house. And it already had problems that I needed to attend to, but I was hoping that it could get me through at least until this coming Friday, which is my surgery date. But my car said no. And it has another leak in it now, and that's stressing me out big time because I already have to put a lot of money into it just to fix what was already wrong, and now there's another problem and I can't drive my car. This couldn't have come at the worst time. Like, now it's coming now, right before I have to have surgery, and I have these these 3 last appointments, but I also have upcoming pre-op appointments, and there's a couple of other appointments later in the month, and it's just like I get stressed. I'm trying not to be stressed, but I'm a stressor, and that's what happens. And so I was unable to bring my son to his appointment to get braces. So I rescheduled that for the end of the month. And unfortunately, he had to walk to school. We weren't that far from his school, but he walked there. And I think he got there within like 5 minutes because he's got legs on him. So he got there very fast. And of course, that same day, later in the day, I had to go and get fitted for the surgical bra that they put on you after surgery, which is in another state. So that's where my surgery is happening. It's happening in a different state than I live in. And I'm just like, how am I going to get there? Oh my God. Like, I was freaking out. But luckily, my friend was able to bring me to that appointment because that was a very important appointment, because that's the bra that they're going to put on me after surgery. And because I have lost weight, they needed to make sure that it fit properly and that they'd be able to adjust it if they needed to, for when that time came. So between my friend and, well, basically my friend, because I don't really have anyone else at the time, she's been helping me get to some of my appointments that I've had. I had to miss my physical therapy appointment on Thursday because I just wasn't able to get there. I didn't have a ride. I didn't have a car. She wasn't able to take me. That's the first physical therapy appointment I've missed since I started going. But she is able to take me today to my physical therapy appointment. So that's very good. but I was able to make it to my pre-op appointment last Friday. So that's good. And I believe that tomorrow, because they do a mandatory COVID test, but you have to do it with their people. So I have to go back down to the other state and get the COVID test. Yay! So hopefully, she can bring me to that. And then I have the appointment on the 10th for my surgery. Now, I do not know what time that is. They will call me either 2 days before or the day before and let me know what time that's going to be. They told me it's probably going to be in the morning. So tentatively, they said 6 o'clock. Could be a little earlier, could be a little later, but they said it's going to be in the morning. So I just have today, Tuesday, and Friday that I'm mostly worried about. And then, like I said, I have the 2 post-op appointments for this month. And then the other ones, I'll figure out when it needs to happen. So hopefully I can do that. Interestingly enough, when I was at my post-op appointment waiting to see the doctor to go over all this stuff, there was a woman that came in and she had COVID and she got tested. I mean, because I was sitting in the waiting room and she had been tested, but she didn't do it the way she was supposed to. You have to get it done by one of their affiliates. You can't just go wherever you want. You have to do it by one of their people or affiliates or whatever. So one of their hospitals, that type of thing. And she didn't do that. She went to wherever she wanted to go. And so they didn't have it in their system. And how they do it is you have to get the COVID test and you have to quarantine 14 days from the test. Not however she did it. She was like, I've been quarantined 10 days since I knew I found out I had it or something like that. And so she couldn't be there and she had to leave and reschedule. But it just, for a moment, I was like, huh? Because she had walked by me and she came within 6 feet of me and I was like, But I've had my flu shot. I've had the vaccine. I've had my booster. So I had asked about that when I went in to see the doctor, and she said that the likelihood of me catching it is very low, but if I did have any symptoms, just to watch out for that. I haven't had any symptoms of feeling sick or anything, so I'm very confident that I'll be fine, but I'm getting a COVID test tomorrow, so we shall see. I think I'll be fine. But when I went in, we went over risks first of all. Well, we went over how they're going to do the surgery, and the risk factors of that surgery. We went over that like the first time, but we went over it again, and the risks are all the same still. Now, the one that is the most, sorry, hold on. The one that I need to worry about the most is developing a hematoma. So that's when a pocket of blood develops under the skin, and it just, or the tissue, I don't remember if she said it's the skin or the tissue, but it will develop, and she said you'll know it because, obviously I'll be sore, but one side will be extremely sore, like so much pain, right? And then one side will just suddenly blow up, right? That's like a hematoma, and that's a direct phone call to her, and then I would have to go back down, and that would be surgery, because that's an emergency. You can die from those. So, but she said the likelihood of getting those is very slim. She said that she's only had, I think, 2 or 3 people in her career that have ever developed one. So it's not too high of a chance, but it's always a risk. With surgery, there's always risks. So you always have to take them seriously. So we went over that stuff. And they gave me some paperwork. So like there's pre-operative information. So you want to have ice bags. Now, the important thing with the ice packs that you use, you don't want to put them directly on your skin, obviously, but especially if you have surgery. And you don't want to like put them all over all of your sutures or whatever they're going to have, like, and just let them sit there. You want to put them on like the tissue area mostly, just to be safer. Now, if your doctor says, yeah, go ahead and put them there, like, that's what your doctor says, but do what your doctor tells you to do or not do, because you don't want to risk infection or, something happening. So dressing supplies or ointment not needed unless otherwise instructed. So that's something you don't want to do, is put ointment on your suture area, because that will cause infection. Even though it hurts and you want to do that, don't do it. Just don't do it. You will heal after surgery. It feels horrible at first, but you will make it through. It'll happen. I promise it will happen. I've not had this surgery up front before, but I've had surgery, and at first it's like, oh my God, but you make it through. You do. You heal. Your body does heal. Obviously you can't drive yourself home. And you can't stay by yourself for 24 hours after your surgery. So you definitely want to make sure that you, like, if you're having this particular surgery, and probably for other surgeries too, but it depends on the surgery that you're having. But for breast reduction surgery, you want to make sure that you have somebody with you that can pick you up, somebody that can be with you for 24 hours after your surgery, so they can watch you and make sure that you're okay, because if anything happens, they need to be there in case they need to call the doctor, in case you have to go back to the hospital, and just in case you need somebody there, because you're coming out of anesthesia. You're probably going to be on pain meds. You're not going to be 100%, obviously. So you need somebody. All right. And somebody that you trust. Don't just make it anybody. Somebody that you trust. So the night before surgery, you want to eat a light dinner. The hospital or surgical center will call you to tell you when you can eat or drink last. So they already called me. You can't eat after midnight, but you can drink clear liquids up until 4 a.m. I'm not staying up until 4 a.m. I'm going to bed early. I'm getting some sleep. So I don't have to really worry about that. So you can brush your teeth the morning of your surgery. Now, when it comes to taking a shower, you can take a shower, but you can't use like soaps and stuff in your hair and all that stuff. You just need to use like water. So if you want to use that stuff, use it before then and get that stuff out of the way. That way, like, if you want to just like rinse off, you can just get in the shower, rinse yourself off, and you'll be good, because you can't use lotions, and you can't use what do you call it, perfume and things like that. Not even deodorant. You can't put deodorant on either. So that's just how it is when you have surgery. There's a reason for it. I forgot why, but you can't use it. And the people who do like it's because of like the anesthesiologist nurse, she called me and we went over all of that stuff. Like, they go over your medications, because certain medications you can have and certain medications you can't. So I had to stop my phentermine last Friday, and I can start taking it this coming Saturday. So the day after my surgery, I can start taking that again. My metformin, the day of, I cannot take that. All my other medications I can take. So it's important that when they call you, you follow what they say, because you're getting anesthesia, and your medications and the anesthesia can interact, and it can be, I'll be honest, it can be fatal. So you need to be very aware of them. You need to be honest with the medications that you're on. And when they tell you not to take something, don't take it. And if you do take it, tell them that you took it. Okay? You need to call them up and be like, I accidentally took this. What do we do? They might have to push it out or reschedule, because you don't want anything happening to you. So now when they talk about anything after midnight, that includes, so you can't drink they say it includes water in here, but they told me, the nurse from the anesthesiologist said up until 4 you can still have clear liquids. That includes water, tea, like herbal tea, coffee, but black coffee, no cream, no sugar. Okay? Like stuff like that. That's why you have to know what, listen to what they say, write it down, know what they're talking about and when. Candy, chewing gum, breath mints, things like that, you can't have that. So, and again, they will call you for like arrival times and all that stuff. So the day of your surgery, you want to wear comfortable clothing. So just wear your pajama pants or yoga pants or whatever you want to wear, just comfortable, okay? Button down shirt, and easy like slip-on shoes. So I was hoping to have an ASO or EVO, whatever it's called, brace for my ankle by now, but I ordered it and it's not coming in until like the 9th. So hopefully it'll come in on the 9th and I can have it before my actual surgery, so I don't have to wear that air cast, because I told them I'll probably be wearing this air cast if that doesn't come in time. And they said, that's okay. It is what it is. I mean, I sprained my ankle, so. All right, leave all your valuables at home. It's probably a good idea. What are you going to need them for? You're going to be unconscious. You do not want any jewelry on your body whatsoever, so take them off, take them out. So it says, typically, if you are on prescribed medications, you would take them with the smallest sip of water that morning. However, you will need to follow the instructions of the doctor and the hospital. Please make sure to inquire about this when the hospital contacts you for your preoperative phone call. If you are unsure or forget to take the... Oh, see, they didn't finish that sentence. Or forget to take the something. Bring your medication with your... Okay, they did not finish this. Okay, well, basically, they're just saying, if you forget, bring your medications with you and then ask them and see what you can take. Whoever did that didn't complete the sentence properly, so I'm not really sure what they're trying to say. Okay, so now this I did not know I was going to have until I went in for my preoperative appointment. And even the nurses didn't know. Like, she made that decision then. The doctor did. So I'm getting a JP drain It's the Jackson-Pratt drain. That's what it's called. Now, I don't have one with me because they don't give you one. They put it on you, in you. Yeah, it's like in you. So basically what they do is, okay, so say this is your breast area, okay? It'll be wrapped around the breast area somehow, and it'll come out on your side. So it'll, I don't know if you can see me on. Okay, so I don't have a bra on, but it'll be wrapped around, okay? And it'll come out the side here, and it'll have a little squeezy thing where the blood, if there's any excess blood, because I am so top heavy, that there may be excess blood, and that can get backed up, which can cause infections, which can cause problems. So what that does is it'll fill up, and then it has numbers on it. Hold on. Come here. I just want that one page. Thank you. And it has like there's this little chart here. So I'm going to have 2 drains and date, time, and then the drains. So it's going to be on both sides, and there's numbers on, it's like a little plastic squeeze thing, and you open it up. Well, it'll have numbers on it. So you write down the number, and then you just dump it out and open it up, squeeze it into the toilet, close it back up, and it'll fill up again. And you just write this down, and that's all you do. So the Jackson-Pratt JP drain is a special tube that prevents body fluid from collecting near the site of your surgery. The drain pulls the fluid by suction into a bulb. The bulb can then be emptied and the fluid inside measured. At first, the fluid is bloody. Then as your surgical site heals, the fluid changes to light pink, light yellow, or clear. The drain will stay in place until less than 20 to 30 cc's, about 2 tablespoons, of fluid can be collected in a 24-hour period, or until the doctor tells you otherwise. Caring for the JP drain is easy depending on how much fluid drains from your surgical site. You will need to empty the bulb every few hours. The bulb should be emptied when it is half full. Before you are discharged from the surgical facility or hospital, your nurse will show you how to empty the collection bulb, record the amount of fluid collected, squeeze the bulb flat, and plug so that the suction works again. So they're going to show me again how to use it, which is very valuable, I think, in case like you forget. It's not that hard, but you know, you're coming out of like, I don't know if they'll show you before or after. I'm not really sure, but if you're coming out of anesthesia and all that stuff, it might be a good idea to see it again, you know. So it tells you how to empty the drain, wash your hands, obviously, with soap, pull the plug out of the bulb, pour the fluid in, inside the bulb into a measuring cup. Now, she said I didn't have to pour it into a measuring cup. She said I can just pour it into the toilet because the bulb is a measuring thing. I just have to write down the number it's at. Clean the plug with alcohol, then squeeze the bulb flat. While the bulb is flat, put the plug back into the bulb. The bulb should stay flat after it is plugged so that the vacuum suction can restart. If you can't squeeze the bulb flat and plug it at the same time, use a hard flat surface such as a table to help you press the bulb flat while you replug it. Measure how much fluid you collected. Write the amount of drainage and the date and time you collected it on the JP drainage output flow chart. Flush the fluid down the toilet, wash your hands. Yes, always wash your hands. So that's what that is. Now, not everybody gets a drain, and of course, I'm thinking, oh my God, a drain, like how big is that? I would say like the tube is like the size of a catheter. It's not that big, but of course it's inside of you. So I'm sure when it comes out, It's probably not the best feeling in the world, but it's probably like a relief as well. But it is what it is, like I'll be fine. I'll make it through it. So post-operative instructions following your breast surgery. You will be placed in a surgical bra at the time of your surgery, which you must wear night and day for the first 6 weeks. You may remove this bra only to bathe and launder. That means laundry, if you were wondering. If you find that the surgical bra is too tight or irritating your skin, you may wear another bra that is comparable to the one you received after surgery. This bra must not be underwire. It should be similar to a non-aggressive sports bra, providing coverage only. You will need to sleep in a semi-reclining position for the first 24 hours after your surgery. This will help decrease the amount of swelling that may occur. If tolerated, apply cold packs to the upper chest area for 20 minutes every hour for the first 24 hours following your surgery. This will help to relieve discomfort and swelling that you may be experiencing. Do not place the cold packs directly on your skin. Apply over your bra. Now, because I have drains, I can't take a shower because you can't get where the site of the drain comes out wet. So I have to sponge bathe for an entire week. So if you don't have drains, then you can shower after 48 hours. So, I mean, at least that's how it would be with this doctor. I don't know about other doctors. It might be different with a different doctor. I don't know. Do not apply any lotions or ointments to your incisions. It is normal to have some bruising from your lower neck area to your waist and part of your back. The colors of the bruises will vary during the first week or two after surgery. It is normal to notice a difference in your breast size. This is due to swelling. You will see the greatest difference in 6 weeks following your surgery. If you experienced back and neck discomfort prior to your surgery, this should be gone within the first week after your surgery. I already read that one. You may return to work or moderate activity in a week if tolerated. Do not lift more than 10 pounds or raise your elbows above your shoulders for 1 week after your surgery. We want to reassure you that it is very normal to experience a burning sensation and moderate pain in your breasts post-operatively. Please take your pain medication as prescribed by the doctor. The pains should subside to a dull ache and may last several weeks. Feel free to call the office at any time to discuss any concerns or questions you may have. Do not drive or operate heavy equipment for the first 24 hours following your surgery or until you are done taking your pain medication. Do not take your pain medication on an empty stomach. Do not take products that contain aspirin for 2 weeks after surgery. So aspirin, Bayer, Bufferin, stuff like that. No NSAIDs, so no steroidal anti-inflammatory drugs for 10 days following your procedure. So like ibuprofen, Motrin, Aleve, naproxen, things like that. So notify your doctor if you have any of the following symptoms: excessive bleeding or drainage from your incision, pain which is not relieved by the medication prescribed, fever over 100 degrees or chills, excessive redness, swelling, tenderness, or foul-smelling drainage on or around your incision, or if you have not urinated while in the recovery room for 6 hours of being discharged. And of course, always call if you have any questions or concerns. Now, the other thing that I did ask was about exercise or physical therapy of any kind, and I'm not allowed to do any exercise whatsoever. My job is to rest and sorry, my job is to rest and to heal. So all I can do is get up and walk around, but not in the form of exercise. I can move around by walking, but I can't be like, let's go walk a mile. I can't do that. So yeah, my body's going to be like, what's happening? What's going on? Why are we not doing anything? It's already kind of like that because I haven't been able to walk the way I was because of my ankle. I am able to walk, do like 4-minute walks 2 to 3 times a day, and then I think it went up to 3 or to like 3 to 4 times a day or something like that. 4-minute walks, but doing like a half-hour walk like every day, and doing the exercises how I was doing it, like from standing now to sitting, it's made a difference. So my body is kind of like, what's going on? I can feel it. My body is like, why have we changed what we were doing? So it'll be interesting. And then I don't know exactly when she'll clear me to go back to physical therapy, but you know, it is what it is. I got to take care of one thing first before I can do another. And that's what I'm going to do. So, so yeah, I mean, today is Monday and that's happening Friday. So I'm nervous, but I'm also excited, and I'm also at the same time kind of ambivalent. It's like when something's coming up and you start to almost feel numb about it, you know? I'm starting to feel like that third emotion of like, I don't know. It's weird. It's weird. I don't know. I guess my brain is trying to process, what's about to happen. Because I know that once I have this, I'm not going to be in control of anything for a little while other than what I'm supposed to do. And I do have things weighing on my mind, and I'm trying not to worry about it, but I am a worrier, like that. I've always been a worrier, and it's really hard for me not to do that, especially when, it's like my car and things like that. So, and then there was like an issue that happened with my son, and I've been worrying about that too. And that one I'm not going to talk about just because of the nature of it. I don't really want to put that on the internet, just out of respect for him. So that one I won't talk about. But the only thing that I will say about that is I want to have a meeting about that before I go into surgery. And they've already kind of messed that up a little bit with what I requested and things like that. So, I mean, I'll talk about maybe that portion of it, but not the nature of what it is, just because, some things are not always meant to be spoken about. Some things are private. But, but my point is that there are things that are stressing me out. I'm trying really hard not to be stressed. So it is what it is. So yeah, I know this was a longer video than I normally make them, but I just wanted to get those things in there just so you knew I didn't post when I was going to post, because, I would have posted this on Friday. I would have posted, but then things happened. I got stressed out. When I get stressed out, I tend to focus on the stress rather than other things, and that's just what happens. So, but here I am making this video, and of course I will let you know what happens with the COVID test. I'm sure it'll come out negative, and also what happens, probably do like, here's me before going into surgery, and here's me after. I'm all drugged up. I don't know. I don't know how it will be, but it might be when I'm home. I don't know. I don't know how that will go because I don't know how I'll feel. I don't know. We'll see. But anyway, so that is where I'm at right now. And luckily today, my friend's able to take me to my last physical therapy appointment before my surgery. So yeah, a little bit of anxiety there. Like, oh my God. I mean, it's just coming up so quick, All right. That's it. Okay. Thank you for watching. I love you all. Thank you for watching. Please take care of yourselves. If you are thinking about having this done for medical reasons, I suggest, you do your research. Make sure that you talk to the doctors, ask questions, make sure you know what you're getting yourself into. Make sure that your insurance will help to pay for it and all that stuff. And you just know that what you're doing is what you want to do. It's okay to do it for cosmetic reasons, but insurance may not pay for it if it's for cosmetic reasons. But when you're doing it for medical reasons and to help in that way, they're more likely to pay for it. They also like to see you doing stuff like physical therapy and other types of things like that, because they like to see people doing things to help themselves in their with their bodies, rather than just like just cut it off, type of thing. So just a little advice there. But of course, take care of yourselves, love one another, love each other, be kind, please be kind, and please drive safe out there. I don't know what has gotten into people. Like, please drive safe. Like, I see you out there, you're not driving safe. Like, I don't see how you have licenses, or the cops haven't caught you yet, but you should be ashamed of how you drive. You really should. You should not be behind the wheel of any vehicle. You shouldn't even be operating a lawnmower. But I'm not the people who pull you over, so. And some of you, I see you got your kids. I mean, I see you. You're sitting there with your phones going like this. Like, really, the road's that way. Follow it. Look where you're going. Some of you have almost hit me on the highway. Like, you're veering into my lane. Like, don't do that. Don't do that. Don't do that. But anyway, please be safe, be kind, love each other, love other people, be kind to other people. Life is precious, not just yours. Everybody's life is precious. Please remember that every single day, every single day, every single day. All right, I'm going to get going now. I gotta go do my exercises, and I will see you in my next video. Can you tell I'm nervous? I'm anxious. I'm nervous about Friday. Can you tell? Can you tell with my anxious hands? All right, I'm gonna go now. I love you guys. Bye. Oh, if I can hit the button. All right, bye guys.